All right, y'all. So as promised, I will finish up the rest of this PowerPoint that we didn't get to in class. Okay, so moving to our, I think like third to last, talking about EFT to treat sexual desire discrepancy. So this reading is useful because it takes a very common presenting issue in couples therapy, which is sexual desire discrepancy, and relocates it from the individual into the relationship. So that is the main conceptual move of this approach. So instead of asking which partner has the problem or why is one person low desire, high desire, whatever, the article asks what cycle is developing around discrepant desire? How does that cycle intensify distress, security, and disconnection? And how is desire shaped by the attachment bond between partners? The authors note that low sexual satisfaction contributes disproportionately to overall relationship distress, and that sexual desire discrepancy is especially difficult because it often becomes organized around blame, pressure, rejection, helplessness, and pessimism. So, a key strength of this article is that it explicitly critiques individualizing approaches. It points out that medical and individual treatments often focus on the symptomatic partner without adequately addressing the relational system that supports or maintains the difficulty. The result is that the lower desire partner is often pathologized, especially women. This reading instead frames sexual desire discrepancy as interactive, cyclical, emotionally organized, and relationally maintained. This is very aligned with how many of us already think systemically, but the article gives you a strong, concrete bridge between sex therapy language and attachment-based couples therapy language. Another important key is that the article keeps returning to emotional intimacy as central. The authors argue that emotional intimacy is not just nice to have, it is deeply implicated in desire, responsiveness, and satisfaction. That makes EFT a logical treatment model because EFT is specifically designed to work with attachment insecurity, negative cycles, and emotional disconnection. So, this is one of the readings that helps you see sexual desire discrepancy is often not about too much or too little desire in isolation. It is about what desire means and how it is organized inside the bond. So clinically, the article is very helpful because it lays out how EFT can be used with sexual desire discrepancy across the three broad stages of treatment. So stage one, de-escalation and assessment. The therapist assesses the history of the discrepancy, when it happens, when it is better or worse, the level of distress, each partner's experiences of sex, touch, health, and emotional intimacy, and the meaning each partner assigns to the discrepancy. The therapist then identifies the negative sexual cycle. A very common pattern described in the article is one partner pursues sex in order to feel close, reassured, or wanted, while the other partner experiences that pursuit as pressure, blame, or demand. Then they withdraw, which increases the first partner's fear and pursuit, which increases the second partner's anxiety and shutdown. This is classic EFT logic applied specifically to sexuality. The therapist is looking beneath reactive emotions like frustration, anger, resentment, pressure to the primary. So they're looking at these reactive emotions, they're moving them to the primary emotional experience, like I feel rejected, I'm afraid I'm unwanted, I'm scared I'll lose you, I feel defective, no matter what I do, it won't be enough. So that emotional deepening is crucial because if the therapist stays at the surface level of frequency, initiation, refusal, desire mismatch, the couple often stays polarized. So then stage two, restructuring interaction. The article emphasizes helping each partner own and express their deeper attachment longings and then helping the other partner receive them. As these vulnerable disclosures happen, the relationship becomes less organized around sexual deficiency and more organized around the need for safety, acceptance, comfort, reassurance, and connection. This is the part that often changes the meaning of sex. For the higher desire partner, sex may stop functioning primarily as a desperate bid for proof of love. Then for the lower desire partner, sex may become less associated with pressure, failure, or obligation, and more associated with safety and closeness. The article's case example captures this well. Once the couple begins to access the fears beneath this cycle, their physical reconnection becomes more possible. The therapist also integrates sensual touch and psychoeducation about spontaneous versus responsive desire, which is a nice reminder that EFT does not exclude behavioral or educational tools. It simply places them inside a safer relational context. So in stage 3, consolidation, by this point, many desire problems have softened because the bond is more secure. If sexual difficulties remain, the article suggests that more traditional sex therapy techniques such as sensate focus can be used, but only after attachment safety has been strengthened. That is a crucial sequencing point for clinicians. So one of the most important takeaways from this reading is do not rush to technique before the relationship is safe enough to use the technique. This article asks us to stop treating desire discrepancy as a math problem and start treating it as an attachment process. The previous reading explained why attachment matters for sexuality in general, and this reading shows what it looks like when we use that attachment lens clinically with desire discrepancy. All right, next article. Sex, Lies, and Headaches. The problem is power. All right, so this reading marks a significant shift from the previous ones. Up to this point, we've been thinking largely in terms of communication, attachment, emotional safety, and relational cycles. This article asks us to widen the lens further and consider how are sexual problems shaped by power, culture, and gendered discourse, not just the couple's interaction. So Hare Mustin argues that what we often experience as, quote, natural differences between men and women are actually socially constructed through discourse, meaning systems that define what sex is, what desire should look like, who should initiate, who should respond, and whose needs matter. This is a very postmodern feminist perspective, emphasizing that language shapes reality. Dominant cultural narratives privilege some experiences over others, and those narratives become internalized in relationships. One of the central claims is that patriarchal structures organize heterosexual relationships, often privileging male desire and minimizing or pathologizing women's experiences. For example, women may be positioned as responsible for maintaining intimacy while also being expected to accommodate male sexual desire, creating a double bind. The article also makes an important critique of therapy itself. Therapists are not neutral. If therapists are not attending to power, they may reinforce dominant gender norms, validate unequal dynamics, or intentionally silence marginalized experiences. This is a crucial addition for us because it complicates purely attachment-based or behavioral models. It asks, are we helping couples connect or helping them adapt to unequal systems? So one of the most clinically useful parts of this reading is its breakdown of dominant sexual discourses. These are essentially cultural narratives that organize how people understand sexuality. So there's the male sexual drive discourse, which frames men as having strong, biologically driven sexual needs, women as responsible for responding to or managing those needs. So this creates a dynamic where male desire is normalized and expected, while female desire is secondary or reactive. Clinically, this shows up when men's desire is treated as standard and women's lower desire is treated as a problem. All right, then we have the have, hold, the marriage discourse. This is a traditional romantic narrative. Marriage is about commitment and closeness, but it often masks power inequality. Women are expected to be emotionally expressive, prioritize connection, and maintain the relationship. Men are often positioned as less emotionally expressive, but entitled to sexual access. This creates tension between emotional labor and sexual expectations. All right, then there's the permissive discourse. This appears more modern and egalitarian. Women can be sexual too. Everyone is free to choose. But the article argues that this discourse often still centers male desire and positions women as complying with that desire under the guise of freedom. So the clinical implication is that these discourses shape what couples believe is normal. So when a couple presents with desire discrepancy, conflict about sex, or dissatisfaction, we have to ask, what meanings are they drawing on? Whose experience is being privileged? What is being silenced? This is when the reading really deepens the previous EFT article. EFT might say, this is a pursue withdrawal cycle. Hare Mustin adds, yes, but the cycle is also shaped by gendered expectations about who should pursue and who should respond. Attachment explains the emotional cycle, but power explains why the cycle looks the way it does. If we only use attachment, we risk individualizing the problem. If we only use feminist theory, we risk losing the emotional process. So this reading pushes us to hold both. All right, next article, addressing issues of sexuality in couples therapy, EFT meets sex therapy. All right, so this article brings everything together in a very applied way. The core premise is simple but powerful. Sexual problems are not just sexual, they are relational problems expressed through sex. From an EFT perspective, sex is described as a reciprocal dance occurring in an emotional and relational context. So instead of saying, what's wrong with their sex life, we ask, what's happening in their emotional bond that shows up in sex? So there's attachment and sexuality. This article emphasizes that three systems overlap: attachment, caregiving, and sexuality. So in secure relationships, partners feel safe, they can be playful, they can express desires, and they can tolerate differences. This leads to more satisfaction, more flexibility, and more connection. In insecure relationships, avoidant partners detach emotionally, focus on performance or sensation, avoid vulnerability, and may disengage after sex. Anxious partners use sex for reassurance, fear rejection, may override their own needs, and experience pressure or distress. So this maps directly onto Sue Johnson's An Attachment and Sex piece, but now becomes clinically actionable. This is where the article becomes practical. It lays out 10 principles, but we can organize them in a clear clinical flow. The first is start with the cycle, not sex techniques. This is critical. The therapist does not begin with techniques, performance, or frequency. Instead, they assess the negative interaction cycle, how disconnection shows up sexually, and sexual problems are framed as part of the couple's emotional dance. Okay, then there's dual assessment. You assess both relational dynamics and sexual functioning. This includes medical issues, trauma, cultural scripts, desire patterns, but always through a systemic lens. So in stage one with de-escalation, before addressing sex, you want to reduce conflict, increase safety, and sometimes even pause intercourse. So this is huge clinically. It aligns directly with sensate focus, removing pressure and rebuilding safety. So stage two, restructuring the bond. Now partners share fears like rejection, inadequacy, and shame. They express their needs and they respond to each other emotionally. These are your hold me tight moments. Sex becomes less about performance and more about connection. So then there's the stage three, integration. Now, emotional safety, emotional intimacy, and sexuality merge. Couples develop a new sexual dance and they can repair when things go wrong. And then there's behavioral interventions when they're appropriate. So this is where integration happens. You can use techniques like sensate focus, psychoeducation, desire models, and they are used within a secure bond, not instead of one. The article is very clear. Behavioral interventions are more effective when emotional connection is established. And then finishing up all of the readings for the week. So, connecting all the readings. Sensate focused is behavioral. It slows things down. It removes performance pressure. It builds awareness, but it doesn't address emotional or power dynamics on its own. Then there's attachment through EFT. This explains emotional safety, organizes sexual experience, and predicts patterns like avoidant, anxious, and secure, but it can miss the broader social context. So then there's feminist and postmodern lenses, or the lens. This highlights power. It reveals gender expectations and critiques, quote, normal sexuality, but it may not fully explain the emotional process. So, with an EFT and sex therapy integration, it talks about how to bring all of this together in practice. You start with attachment, you address the emotional safety, you integrate behavioral tools, and then you stay aware of power and meaning. Because sex is not just behavior, biology, or even attachment. It is relational, emotional, and socially construct. It is a relational, emotional, and socially constructed experience happening between two people. And that's all I got for y'all.